I have had quite a few clients come in to my massage room with pain between the shoulder blades going up into the back of the neck. So a few quick fixes for this, and I say quick very liberally. Nothing is a quick fix. We want to be able to do these exercises for about 4 or 5 days, maybe a couple times a day if you have the time. But the first thing we're going to do is we're just going to warm up the neck by pulling back. So I'm doing all of these on my knees, but in a postural position that's very comfortable for me. So make sure if on your knees isn't comfortable, you are sitting on the floor, you can sit on a chair, on a bench, you can do it standing. But we want to be very comfortable and pretty much relaxed in this position, with the exception of gently holding in your core to elongate your spine. So right now my sacrum is down through my heels towards the floor, and I am just going to gently inhale through my nose, and then I'm going to exhale and pull my chin back. My shoulders are gently down by my side, hands are on my quads. Inhale through the nose, and exhale, pull the earlobes back, or press the back of the head. So it's almost like you're pushing your chin in. We're going to do 5 of those. After 5, you're going to leave the chin somewhere in between your normal, really pulled back, find a neutral place where it can sit comfortably, where you still feel little to no strain all the way from your head to your tailbone. So core is gently engaged, pelvic floor is gently engaged. We're going to have your hands open now, palms up, thumbs out. Start with your pinky fingers together, elbows resting by your side, gently engaging your lats to pull your shoulders down. Gently tucking the chin, keeping that neutral. Inhale through your nose and exhale. As I exhale, I'm breathing out, pulling my core, my belly button up and in. My chin stays where it's at. My shoulder blades go down across my back, and I push my thumbs back, but not my elbows. So just my thumbs are going to go back here. 5 of these. Inhale through the nose. Exhale. Pulling your core in. Hands are going to be grounded now. Chin is in the exact same spot, so just find that neutral. And you're going to inhale, exhale, earlobe to shoulder, and hold there and breathe. You'll feel a stretch through that upper trap. Now turn the hand so that it's palm facing forward. The other hand can be down, just touching here. If this doesn't work for you, you're just down towards the ground if you're standing, right? So just let gravity take over, so your earlobes, shoulders aren't up in your earlobes, and you're just hanging out here for the 5 thoracic breaths. That's in through your nose, out through your mouth. On that exhale, let everything just fall towards the floor except for your abdomen. It's staying slightly engaged. After that 5th breath, instead of bringing your head just up from that position, you're going to actually gently tuck the chin and do a semicircle, rounding through the back and then coming back up. Take a couple, just shake it out there, reach back down towards the ground, gently engage, tailbone and head straight, not feeling much tension, neck is in that neutral position, palm facing out on that left side, and right earlobe to right shoulder. Inhale and exhale. Engage and drop shoulders. Inhale through the nose, exhale through the mouth, and again. You feel your arms getting longer towards the ground, your spine is getting longer, going up this way, and we're just decompressing all that congestion that gets in those joints and in that vertebrae. So last breath, in through the nose, really let yourself exhale here. At the end of your breaths, however many you choose to do, there should be very little tension, still feeling it in that upper trap and levator. So once you're done, you're tucking the chin down into that circle, rounding through the shoulders, and then pulling yourself back up. That's our warm-up. Now we're gonna take a TheraBand, and you can have a really light band. This is a little bit thicker than what you might want to use, but I like it because it's a loop. You can buy real cheap loops like this at even Walmart now, Canadian Tire, but on Amazon. One of the best places to find them, but we're gonna come here, okay? Lock into your thumbs, another reason that I don't have to grip them, that I can just push out with my hands. So now I'm gonna come up onto my knees, I'm gonna curl my toes underneath, okay? Pulling the core up and in. From here, I'm going to keep that chin nice and neutral. I'm going to inhale to prepare, and I'm going to exhale, press out and open up through my back. So where I'm putting this band is right where I'm feeling the tenderness in between the shoulder blades, okay? So it might be on a vertebrae that you're feeling that tenderness, it might be on a musculature area, but no matter what, you're putting it near and around that area where you're feeling the tension. Slightly below it is best instead of above it, if you had to have one or the other. But we're gonna be here, inhale and exhale, gently gazing up. Okay, you should be feeling no pinching in that lower back, so you're only extending back as far as you can kind of push yourself up to brace and feel. Holding there for a breath, bringing it back in for an inhale, exhale, inhale. When you inhale through your nose, you're still holding the core in, so you're not letting it out, right? That feels pinchy in the lower back, but you're breathing into the back of the TheraBand and then exhaling, letting the air out of the lungs. Coming back into an inhale and exhale. Inhale into the TheraBand, exhale, let the TheraBand go. Inhale, come back to neutral, last one. Breathe out through that pursed lip, inhale through the nose, into the back of the TheraBand, exhale, and inhale. Good. If the knees are getting sore, the toes are getting sore, it's an indication that we probably need a little bit more stretch through that plantar flexion. Coming up, you can do the same thing in a standing position, or you can come up, just give yourself a little bit of a break from that position. I'm going to use my chair just to show you the different positions you can do all of these things in. So on a chair, I like to sit on the edge of a chair or a bench. So again, you're using a little bit less core when we're in a sitting position, but the core is just used differently. So we're elongating the spine. We're coming into a slight flexion of the hips. We're going to take this TheraBand, okay, and we're going to rotate the hands so the palms are facing up again. We're going to start by our sides, okay? We're going to come up. As you're pushing the TheraBand out, you're coming up and looking down towards the toes. Inhale, and then exhale. Inhale, and exhale. As I'm exhaling, I'm just putting about 10% press outwards, okay, into the TheraBand, and I'm trying to engage the lats and elongate the spine. So I'm really thinking about my head and my tailbone going out this way. As I breathe out through pursed lip, I'm pulling my abs in, which is really going to help elongate the spine. And the pressing out of the TheraBand is going to push into that serratus and lat muscle. These are my great stabilizers, and they help with the glide and slide of my shoulder blades. If the shoulder blades don't have glide and slide, we're going to get stuck. We're going to have more tension in through that mid back, okay? So we're gonna be here, okay? Inhale and exhale. Pull the belly button in, elongate the spine, press the TheraBand out. Inhale and exhale. And the better you get at this, the more comfortable you are. You can actually bring those arms up past your head, but you don't want to push your head down. You're keeping your head at that neutral, gently pressing out. Each repetition, you might get a little bit further, but you will always want to stay out of any pain point or too much tension. So I'm starting to feel a little bit too much on my left. I'm not going to go as high this time. Last one, inhale through the nose, exhale through pursed lip, nice long spine, and done. From there, we're going to go into kneeling on the floor again. You can use a pillow underneath you. You can use a bench or anything, but you're going to place your elbows on a bench, okay? And we're just going to use some thoracic mobility. So as you come up to start, you're rounding out through that mid back, like you're pushing some space between your shoulder blades, okay? You'll feel a little bit of tension in your triceps and in through that serratus muscle. Your core is engaged, okay, to keep yourself balanced here. You're gonna inhale here, and then you're gonna exhale, drop your bum in your chest and your head down towards the floor. Bring the hands back towards your neck, okay? Inhale here, round out, and exhale. Really breathe out through that pursed lip. And now hold here. Inhale into the lungs, but stay here, and then exhale through that pursed lip. And then do one more moving. And then exhale. Hold here, one breath in. And then exhale. Back up to the top on your inhale. And then come forward and take a breath. We're going to do a cobra here, just like so. So a lot of times we get told to do a cobra or a baby cobra to help stretch out our back. And if we do have any issues with our lower back or pelvic dysfunction, it's not going to be the best place to start from. So if this is super easy, you can go down to the baby cobra or the cobra, but we're just going to start here. Again, pillow on your knees if you are having any tenderness in that patella. If not, get those knees a little bit stronger, right? It's okay to have our knees to be able to kneel on the ground, okay? So we're going to be here, okay? Nice strong wrists, so not putting a lot of pressure into the wrists. The pressure is into that core. We're engaging through the core, gently engaging through the glutes. Opening up, inhale, and exhale. As you exhale, core is still engaged. I'm not letting it all go. I don't want to feel any pinching in my low back. So a gentle engage of the glutes, open up, pressing through the hands, opening up through the chest. Inhale and exhale here, holding for those 4 to 5 breaths. And coming out of that position and just rounding through the back. Just a few circular motions where you're just rounding through the core. And you should feel a whole lot different and a whole lot more warmed up in both the front and the back body, all the way up through the neck, down into the tailbone. I end this one with my foam roller. Lie down. So I go on my big foam roller. If a foam roller is too much, because it can be, especially if we're super tight in the chest, or we have quite a lordotic curve in our lower back, we want to just roll up a nice long towel and do the same thing with a rolled up towel. Okay, so tailbone on one end, slowly roll down, articulating one vertebrae at a time, moving any ponytails or hats out of the way that might feel uncomfortable. We want our spine to be comfortable at this point. I'm going to place my feet hip width apart and just gently let my knees fall where they want to. Okay, making note that we're not off a whole lot. Okay, being mindful of our lower back, we can have a little bit of a curvature here. And we're gonna open up the spine, open up the thoracic spine and the chest by placing those palms up, thumbs towards our ears. Gently tuck the chin. None of this should feel super aggressive, so if it does, then we might want to move to that towel. Inhale through the nose. Exhale. Really allowing that chest to open up. Each breath, inhale and exhale. A great time. We're not really focusing on keeping our core engaged right now. We're letting everything just rest into the foam roller, allowing the fascia around the spine to break and breathe, allowing the fascia and the chest muscles to open up. After a few breaths, there should be, very little tension really, and a lot of us will be able to get those elbows resting comfortably on the ground after a few breaths. And for this one, you're staying here from anywhere from 1 to 2 minutes. Just really quiet your mind, take your breaths, and allow the fascia to just sink down towards the spine stick, the foam roller, or the towel, and just breathe. Once you're done in this position, instead of just bringing our arms coming flying forward, I'm going to bring my arms down and roll them in. And I'm going to roll my thumbs down towards the ground. I'm going to roll my knees in so they're touching. My toes are inwards as well. Everything is going to go in, keeping my legs where they are. Everything is going to roll out. I'm just going to gently squeeze my shoulder blades into the foam roller to reactivate them. Inhale through the nose. Exhale, gently squeeze. Inhale and exhale. If you're feeling tension at this point in one side of the neck or the other, you're going to just gently tuck the chin and bring your earlobe as far as you can to one side, and take 5 to 10 breaths here. If you're feeling some tension, we want to release it. So you're going to gently take your fingers and just pull that down towards your collarbone and tap at the collarbone or just below. Pull the tension and tap. Same thing on the other side. Palm is down. Find neutral again. A couple breaths there. Switch to the other side. Pull through the neck. Gently, gently, gently. This is just really finger-like. 5 grams of pressure or less. That's like just a nickel sitting on your hand. Such easy, light pressure, just to get some of that lymph fluid flowing. That's usually why we have also a tight neck and stiff shoulder blade regions. Is our back does not have a lot of blood and lymph movement in it, so we have to create that blood and lymph movement ourselves. Getting off this thing for me is as simple as gently falling to the side and allowing myself to come up from a laying position. Give this a shot. Comment below if you have any questions and or feedback, and we'll go from there. Any other issues that you have that you want me to make a video for, let's do it.